Being a nurse is such an honor. You are with patients in the most intimate moments when there's a new person who comes into their family or when someone leaves their family. And it's also a very clinical, scientific environment. So you have the emotion, you have the science, and you also have the education and the relationship with the patients. Good nursing leadership is just essential to providing good quality care. The majority of the providers are nurses, especially in acute care setting, and now we're starting to see that all along the continuum. So as leaders, we need to make sure that there's a shared vision, that people have the resources that they need, people know what's expected, people have a voice in the care they're delivering, people are able to focus on patients and families, and our job is to get them the resources and get the barriers out of their way.
AONE has been a remarkable opportunity for me. I met role models, I met mentors, I met people who cared about my progress in my career. When I attended CNL, the Center for Nursing Leadership, in 1999, I had only been in my current position for about 4 years. I am Director of Diversity for Patient Care Services at Massachusetts General Hospital. I am the first in my position, so I didn't have a path to follow. Nothing was laid out for me. So I had to invent it as I went along. It was sort of trial by fire. I had a reputation in the organization already as a staff nurse, but now I had to create myself as a leader, which was something very different. So CNL helped me to stop for a moment, think about my position and what I wanted to accomplish.
I became involved or engaged in AONE, networked with some very strong leaders across the country. So anytime you're really working with AONE, you've got a family. Early in my career, I used AONE and I soaked up everything that I could. At a certain point, I started to give back to the nursing profession, and that's what I've been able to find through AONE all along, to be able to learn and then to be able to give back to the same profession. If I could just do a portion of what my mentors have done, and I hope that at some point in my career, I could say that I could leave a legacy for patients, for our staff, and for the people that we work with.
I look at Bob and I see not only that passion that you have for leadership and nursing education, but how you put that into practice and how you always deliver the consistent message, and how I can always look to you for the example of how we should be doing things. And I want to give that same kind of experience that I got with Bob to someone else, and that is part of Bob's legacy, is that he has put in me that fire, that spirit, and that confidence that I want to pursue that, and I want to give that back as well to the next generation of nurses. So that's what really drives me to do this.
This is my first time with AONE. I'm really excited to be at the convention this year. AONE has a fellowship program, a nursing fellowship program, and I applied for the 2015 nursing fellowship program. And our first session was in January of this year in New Orleans. And actually went there with very limited expectation. Went there with the thought of, okay, I'm gonna do this, I got in it, am I gonna meet some new people? I probably am. Was a little tired as a manager, as a director. And when I went, it was invigorating to speak to people who had some of the same issues that I had. But you know what the most fascinating part about this is that after leaving that program in the last 3 months until this visit, oh my goodness, the numerous emails that we've been sharing about processes, protocols, suggestions. It is just unbelievable from all across the country. And so here are a group of people who came together with very limited expectation, but seeking something, who now have the opportunity to grow and learn from each other. As a nurse leader, the most important thing that I can do is impact the growth of the next generation of nurses. In order to grow others, we have to grow ourselves and support ourselves and find time to breathe. And that's why I'm here at AONE.